It is exactly 22 minutes past 9 a.m. East African time. Good morning and welcome to our Mental Health Discourse. Now, Mental Health Discourse is right back with a bang, bringing you pertinent conversations on general health to make sure that you are up to date with the information about different kinds of diseases and disorders and how best to go about them, preventive measures, and of course the best lifestyle practices to embrace in order to stay safe and fit, both mentally, physically, and socially. So today we are really set to delve deep into liver cirrhosis. But before we get to know more about what this is and how it affects the body, the causes and the treatment modalities, first things first, allow me to introduce our guest, Dr. Owiti. Welcome.
Thank you. Thank you.
Please speak to the viewer. Tell us about your department, where you specialize in.
Okay, my name is Dr. Owiti Calvis. I'm a medical officer at Mater Hospital. I work at the outpatient department. Yeah.
It's good to have you. Thank you for making time for this discourse.
Thank you for having me.
Welcome. All right, and my name is Sasha Elizabeth, and you can talk to us if you have any questions, any contributions to make. Our number is 0717-424-866. Our SMS line remains 21760. And welcome. Let's talk mental health. We are back again, and it is the month of love, February. So we give love in form of information to our viewer to equip them in order to stay healthy. So what exactly is this liver cirrhosis?
Thank you. Liver cirrhosis is an end result of a number of processes in the liver, actually a number of diseases, but it's basically characterized by excessive scarring of the liver, what we call fibrosis, and with formation of some nodules. So that pattern in the liver is what we call cirrhosis. Yeah.
And what are the causes? What causes these perforations or deformation of the liver?
Yeah, so there are a number of things, and it's usually a result of injury to the liver by a number of processes or caused by a number of disease processes. One of them is hepatitis. Hepatitis, for whatever reason, caused by a viral infection, caused by an autoimmune disease, caused by certain drugs. And when we talk of drugs, one of them is, the major one is alcohol, and the other drugs that are prescription drugs that may react with the liver and actually cause damage, or poisoning caused by certain chemicals. Yeah. Then there are genetic diseases that actually, with time, may cause liver injury and then cause cirrhosis eventually. Yeah. So there are genetic diseases that, for example, enzymatic diseases that limit someone's ability to process certain nutrients like carbohydrates. So an example is the glycogen storage diseases. So you have a deficiency in a particular enzyme, you are unable to utilize certain nutrients, and then eventually there's a process that leads to liver injury, and then eventually you get cirrhosis. Yeah. So those are some of the causes of liver cirrhosis.
Some of them, all right. So now maybe before we proceed to the details, could you please let us know what is the global burden of cirrhosis of the liver?
Yeah, it's estimated that about 2 million people die annually due to complications of liver cirrhosis. And it's actually the 14th leading cause of death worldwide. Yeah.
So as medics, or just an ordinary citizen, what should they make of that? Does it mean that there's no enough access to information, or it's just unhealthy life practices? Or what should we attribute this to?
The bottom line is unhealthy life practices, but that can be contributed by inadequate access to information, Yeah, but there are people who know. People are well informed. Even, yeah.
But they still go ahead
Yeah,
to...
yeah. But there are some causes that people cannot control for sure, like the genetic diseases. Someone cannot really control some of them. Yeah.
Every disease comes with some red flags, some telltale signs that will show you that this one could be indicative of a particular ailment or disease, health disorder. So in the case of liver cirrhosis, what are some of these signs and symptoms?
Yeah, liver cirrhosis, you know, the liver is in the abdomen. But when things go wrong with the liver, nearly all other organs complain. Yeah, and one of the things someone might realize is swelling of the cheeks. There are glands here called parotid glands. So that is one of the things. In men, you might see gynecomastia. The breasts are just becoming bigger, and you wonder why. And then you go to the abdomen, you see certain abdominal distension, excessive fluid accumulation in the abdomen. That is one of the things. And if you look at the abdomen, you might see enlarged veins in the abdomen. Yeah, yeah.
So the veins protrude on beyond the skin?
Yeah, beyond the skin.
Okay.
Yeah. And then some people may present late and they just present with bleeding. They vomit blood, yeah, or hemorrhoids. Yeah, so there are a number of manifestations of the disease. In late stages, someone just presents with confusion. We are going to talk about the disease processes that lead to each of those as we go by.
So it also affects the cognitive equilibrium of a person.
Yes.
Okay, so in terms of these severity levels and stages, can someone tell that this is which stages can present themselves, and how can someone tell?
Yeah, so initially someone may have cirrhosis without symptoms. The liver is scarred, not all of it. The scar tissue is there, but not so extensive to an extent of causing clinical manifestations. And then you may have, someone may have liver cirrhosis that can only be detected via maybe some investigations or lab or imaging. So you do some lab investigations, you notice certain changes that are worrying, but still no symptoms. But in advanced stages, that's where we start getting abdominal distension and bleeding and enlargement of the parotids and some skin changes also. Yeah. Liver cirrhosis in advanced stages can also cause kidney injury. There's a correlation between the liver and the kidney. And it can also cause sexual dysfunction as well. Yeah.
To both male and female?
But mostly in men basically.
So when should someone see a doctor or seek medical attention?
Yeah, so the first, what usually brings people to hospital is when they start having symptoms that they can't explain. They have fatigue, and then they notice some abdominal distension, just abdominal fullness, and they wonder what's going on. And then they have yellowness of the eyes. That's a sign. If someone gets yellowness of the eyes, they are for sure they are going to go to hospital. So those are the things that usually bring people to hospital. But when you dig deeper, you find there are a number of issues that are underlying.
So when someone comes to hospital, what kind of diagnoses are performed on this person to establish whether they are liver cirrhosis positive or negative? Yeah,
there are tests. There are lab investigations and there are imaging studies. Yeah. The labs that are usually done, we do liver function tests. The work of the liver, the liver does a lot of things. One, the liver metabolizes drugs. You take paracetamol, it's metabolized in the liver. So there are some enzymes also that are stored in the liver, but when the liver is injured, you get them in blood. So we check those enzymes. Sometimes you might find they are elevated. And then we can predict something is going on. And then there are things like ammonia. They are produced by the liver, and there's a way the liver takes care of it and converts it to a safer chemical that can be easily be excreted. So you measure ammonia level and find it's high, there's a problem. And then the liver also produces clotting factors. So clotting studies can be done. If you find some abnormality, most probably there's something in the liver. And then we can do imaging. There's a form of MRI called magnetic resonance elastography that can determine the extent of scarring in the liver. But there are other imaging investigations that we do, like ultrasound, CT scan. Those ones can also show abnormalities in the liver. Yeah. As
a medical officer, would you recommend someone to come for tests even without noticing any symptom?
Well, part of wellness, sometimes certain individuals may be encouraged to undergo liver investigation as part of wellness, especially people with certain genetic abnormalities that may predispose them to liver injury. There are abnormalities such as abnormalities in iron metabolism, where there is excessive accumulation of iron in the body. It can accumulate in the liver and cause cirrhosis also. And also deficiencies in the metabolism of copper. Copper, if it accumulates in the liver, cirrhosis may also develop. So certain individuals may be encouraged to do liver function tests. Also, people who have had hepatitis B or C, they are at risk of developing liver cirrhosis. So they can also be encouraged to undertake a liver function test. Then there are people who take certain drugs for other reasons, medical for sure. So there are certain drugs that may damage the liver, but they are essential for the treatment of the certain illnesses. So such people are also encouraged to take liver function tests. Actually, the practice has been before you start those drugs, you do liver function tests. Then somewhere in between, before you finish, you take liver function tests to see where things are going. Yes.
All right. Now, is there a specific age bracket which is at more risk of contracting liver cirrhosis?
We normally see it in adults. And the reason being, the number one cause of liver cirrhosis in our setting is actually alcohol. Yeah, so we have alcoholic liver disease. So usually adults, the ages of 18 going forward 40 there. Yeah, that age bracket, that is the commonest age bracket for alcoholic liver disease and cirrhosis. Yeah, children, you may not really find them a lot unless they have genetic defects. Yeah.
They say prevention is better than cure.
Yeah.
What are some of these health practices that could be embraced to keep this cirrhosis of the liver at bay?
Okay, so number one is limiting the amount of alcohol that someone takes. Studies have shown that if someone consumes more than 14 units of alcohol in a week for a long period of time, someone may be at risk of developing liver cirrhosis. So limiting the amount of alcohol is key. And there are certain lifestyle changes that are also necessary, like diet and weight loss. Because there are people who do not consume alcohol. They do not have any genetic defect, but they start with having a fatty liver, excessive fat accumulation in the liver. And eventually, inflammation sets in, they get cirrhosis. So obesity is one of the things that causes cirrhosis. And then practices that may prevent someone from developing or contracting hepatitis viruses. Yeah, you know, hepatitis B, C, can be the most common mode of transmission is blood. So practices that may prevent someone from developing those viral infections are also key in preventing liver disease. And then limiting other drugs. There are many other drugs of abuse for sure that people take that can also damage the liver. So limiting intake of such substances is also key.
Okay, now before we take a short break,
Yes.
Let's briefly talk about the treatment modalities that are available for liver cirrhosis and underlying causes of liver cirrhosis.
Okay.
Let's start with the underlying causes.
Yeah, so treatment of the underlying causes. So basically you look at, once you have established the diagnosis of liver cirrhosis, now you look at what may have led to it. So if it is alcoholic liver disease, number one thing is to stop taking alcohol, with the hope that you may reverse. We may either slow progression of the disease or reverse in rare cases. And number two, if it is a genetic defect, let's say in the body's ability to take care of copper or iron, there are chelating agents that someone can take. In the case of iron, someone can undergo phlebotomy. You release some blood. Someone lets go of some blood. And there are also chelating agents also to take care of that aspect. Then weight loss regimen for people with fatty liver because of obesity. Yeah, that is one. Then if someone has viral hepatitis, there are antiviral agents that can be taken. And but for viral hepatitis, the goal is usually to prevent through vaccination. Yeah, and then there are people with autoimmune hepatitis, the body reacting to itself and damaging the liver. So they are immunosuppressants. They are drugs that suppress the immune system that such people are given. Yeah. Okay,
so now the kind of treatments, does it depend on the stage of the disease?
No, usually
do they vary, or it just applies to all?
So once you establish the diagnosis of hepatitis and you know the underlying cause, you just try as much as possible to address it. Yeah. There's one more underlying cause that most people don't know. A number of our viewers may not know. Heart disease can also cause liver damage. When the heart is failing, then there's backflow of blood. That may eventually damage the liver. And there are also abnormalities in structure of blood vessels around the liver that actually can cause liver cirrhosis eventually. So if it is anatomical defect, surgical correction may be required. So
patients with cardiac conditions are at more risk of contracting liver cirrhosis?
Yeah, they are. Yeah.
Now, when you're taking care of them, do you have any preventive measures to patients with their cardiac conditions?
Okay, so usually if it is cardiac disease, you address the heart. Yeah, ensure you control that nicely to prevent complications in the liver.
All right.
Because even once you have complications in the liver, it will be a vicious cycle. You go back to the heart and everything worsens. Yeah.
Thank you very much, Thanks. Dr. Wite. Healthy citizens are the greatest asset any country would ever have. Time to take a break. We'll be right back with more. Stay with us.
Capuchin TV, your Catholic identity. Welcome to Mater Misericordia Hospital, Nairobi CBD Medical Center.
Development House Medical Center was opened about slightly above 10 years ago, and since then we've been providing ambulatory care to clients who come to us. The clinic is located on between Tom Mboya Street and Moi Avenue, right opposite the Pioneer Building.
We guarantee our patients quality standards and variety of medical services.
At Development House Town Clinic, we have the following services. We offer doctor's consultation. We also offer physician services on Mondays and Fridays, obstetric and gynecologist services on Wednesdays and Saturdays, nutritional services on Fridays. We also have a well-equipped pharmacy, a well-equipped laboratory. We have physiotherapists, and we also have just begun our wellness services as a way of encouraging preventive medicine.
We provide specialized services, that is gynecology and antenatal clinics. We provide services to the diabetics and the hypertensive patients. We give nursing services. We will do your dressing, we give you injections, we also provide some counseling services. We have specialized counselors that would give you natural family planning counseling and guidance, and you'd also get the general counseling. We also provide adult immunization, and basically for adults who want to travel, we are able to give you the vaccines that you need.
We uphold the dignity and privacy of our patients as we strive to meet your healthcare needs holistically and in a more compassionate way.
The service that you'd receive at our medical center is a value with a touch of Christ. We do not just want you to be taken care of physically, but you also think about your spiritual care and spiritual growth.
Visit us every Monday to Friday from 8 a.m. to 6:30 p.m. and every Saturday from 9 a.m. to 3:30 p.m. and get value for your money.
We ensure that you're seen within the shortest time possible, however, providing quality care.
I welcome you all to Mater Hospital CBD. We assure you of timely, efficient, and satisfactory services.
Catherine Macaulay Nursing School is a leading institution in Kenya offering competitive training in nursing education, innovation, research and professionalism.
We are a nursing school that was started way back in 1972, chartered as a midwifery school. The school is run by a highly qualified faculty. All the departments, for example, you look at midwifery, it's headed by someone with a PhD in midwifery. Critical care is headed by a highly specialized person with a master's in critical care. Nephrology, the same. Our clinical instructors for these programs are also specialized in their various fields.
The school is licensed and accredited by the Nursing Council of Kenya to offer holistic training in various nursing programs.
We have general nursing, that is the Kenya registered nurse. We have higher diplomas in Kenya registered midwifery, Kenya registered critical care nurses, Kenya registered nephrology nurse, and also we have theatre nursing, which is called Kenya registered perioperative nursing. We do admit our students from all over the country, especially for the basic diploma, that is the Kenya registered nurse program. And for higher diplomas, we admit, again, we have a Pan-African presence. We have students from Congo, from Rwanda, from Uganda, and from other countries. But basically, most of our students are Kenyan, those ones who have graduated from our Kenyan institutions.
Enjoy your learning in a friendly environment with adequate training facilities, including a fully fledged skills laboratory, library, lecture halls, and accommodation amenities.
We have good facilities for our training. We have a very well equipped skills laboratory. This is for all the programs, both the basic diploma, the Kenya registered nursing, the midwifery, the critical care.
Nursing is a noble profession because we work with our clients at different stages of their lives, right from birth up to end of life. When a baby is born, a nurse is present. When a baby is brought to receive vaccines, a nurse is present. When you fall ill, the nurse is by your side. And even at the end of life, a nurse is present. So we are there to give our services throughout each stages of human life.
For more information, call us on 0732 163 164 or 0719 073 164 or visit our website at www.matakenya.com.
Capuchin TV, your Catholic broadcasting ministry.
Welcome back, and thank you so much for keeping tabs with us here on Mental Health Discourse this Friday morning. Today we are discussing liver cirrhosis, and this is our second session of the discussion. In the first session, you are just trying to understand the basics, the concept of liver cirrhosis, the causes, its prevalence rate, and other risk factors that can predispose someone to this liver disease. So welcome back, and keep your questions and concerns coming. We'll get them responded to, and our number is 0717-424-866. You can also send an SMS to 21760. Welcome back, Dr. Wite.
Thank you.
Yeah, remember this is brought to you by Mater Misericordia Hospital in partnership with Capuchin Television Network. So to continue with the treatment modality or treatment measures, first of all, there is a question that always pops out of a patient's mind. Is this disease curable? Can someone be cured and be declared liver cirrhosis free?
Usually, if it's at an early stage, we aim at preventing progression of the disease, and to some extent try and see if we can reverse, but rarely is it reversible. But the progression can be halted, and to prevent complications. Yeah, that's possible. And once complications are there, we address them.
So does it mean that the treatment is continuous from the time of diagnosis? Or are there times that you recommend a patient to come for checkups and reviews?
Yeah, once there are people who have liver cirrhosis with complications, but if we stop the offending agent, if it is alcohol, if it is autoimmune disease, once we address the offending agent, most of the time they recover. Sometimes treatment may be frustrating, especially if the underlying disease is not addressed.
So now, at what point do you recommend liver transplant or organ transplant? Because we understand that organ transplant comes with their own complications. There are issues of compatibility. At what point, as a medic, do you consider now a transplant?
Yeah, transplant is is usually a matter of last resort. Before we go for a transplant, we try to do a number of things to address the complications. Let me just touch on the complications and how to address them before we get to the transplant. And some of the complications of cirrhosis, one of them is what we call portal hypertension. Portal hypertension is basically high blood pressure in the venous system, the veins that go into the liver. So because of cirrhosis, blood cannot easily pass through the liver. So there's a build-up. Yeah? So that is what eventually causes distension of the abdomen and also the prominence of blood vessels around the umbilicus. Yeah. So there are a number of issues of dealing with portal hypertension. Number one, there are drugs that there are medicines that can be taken to try and reduce the pressure there. And number two, there are surgical options. So if the blood vessels going to the liver are not functioning nicely, you can bypass the blood flow. You avoid the blood vessels going to the liver, you shunt blood to another vessel so that the blood can find its way into the heart and then back. Yeah, that is one thing. The other complications resulting from portal hypertension, like abdominal distension, because of fluid buildup. We try and remove the fluid, we analyze it. Sometimes we remove a large amount of the fluid, and that also has complications, which we address. And then the same portal hypertension can cause bleeding. Remember those blood vessels that that are not functioning nicely because of pressure in the liver. So the buildup of blood goes back into the intestines, and then there are some blood vessels that pass through the stomach. So that buildup causes enlargement of those blood vessels, and they may rupture and cause bleeding. So someone presents with vomiting blood, and it's actually liver. So that one, those blood vessels, once we identify them, banding can be done. You just tie them. Yeah. That's one. Another important complication of cirrhosis is what we call hepatic encephalopathy. Hepatic encephalopathy is some abnormality in the neurological function because of liver disease, and is usually caused by buildup of toxins. Remember, the liver takes care of drugs and toxic chemicals. So if the liver cannot do that, then those things build up and cause issues with the brain. So usually symptoms can range from mild symptoms like just confusion or memory loss a little bit to coma. So that is also treated by using a number of methods. One, we try and limit the amount of chemicals that are released into the body. One of the chemicals is ammonia. If the liver cannot handle it, it builds up and causes issues. Cannot even cause convulsions. So what we do, there are some antibiotics that are given to reduce the bacterial load in the intestines. Those bacterial organisms, there's a way they generate ammonia. So that one we do. We also give some chemicals called, a drug called lactulose. Lactulose also has a way of reducing the amount of ammonia that is produced. But those are temporary measures.
So this is done to minimize the risk of cognitive instability or cognitive issues.
Yeah, and it's usually an emergency. Hepatic encephalopathy is one of the nasty things that we don't like in liver disease. And then there is what we call hepatorenal syndrome, where there's liver disease causing kidney injury. What we tend to do is to deal with the liver disease, and eventually we hope the kidney function will improve. Yeah, and then there is infertility in men, sexual dysfunction and infertility, and it's caused by buildup of certain chemicals, especially estrogens in men, because the liver is unable to function nicely. There's a way the liver takes care of those hormones. So again, that one, we address the liver disease and hope things will improve. Yeah, and then the last one, we've talked about surgery. Yeah. Now, if you've taken care of all those things, and including bleeding disorders, you try and transfuse platelets or things called fresh frozen plasma, because the liver is unable to produce clotting factors. Once you have addressed those ones, and it becomes it looks like it's dependent on those interventions to survive, and there's no hope, the best thing to do is liver transplant. Now, transplant can be partial or complete. So to get a complete liver...
How does the partial one work out?
You just get a lobe of the liver, I mean the liver from a living donor.
So you just replace the affected part?
You can, usually you find the whole liver is affected, but you need some element of liver function to work. So you get part of the liver and transplant it and prevent it from scarring. So that small part of the liver will take over the function of the liver. At least it will improve in taking care of the metabolism and those other things. That one you get from a living donor. You can also get the whole liver from a deceased donor. Yeah, but then once you transplant the liver, you have to deal with rejection, graft versus host disease. Yeah.
So what is the compatibility ratio in the case of liver transplant?
The compatibility ratio, we can't really tell. What we do before the transplant is done, you must look for a donor. And number two, you have to be compatible. So a number of tests are done. Yeah.
So can it happen that after the transplant, the body rejects it?
Rejection do occur. But it's dealt with. It's dealt with using immunosuppressant. The same way kidney transplant is done, and then there's rejection. But there's a way of dealing with the rejection. Yeah.
Does the transplant somehow reduce someone's lifespan?
The aim of liver transplant is to improve someone's lifespan.
Yeah,
so
it's a question of concern.
Yeah, unless a catastrophe occurs where there is overt rejection and inflammation and someone dies. But the aim is to actually improve lifespan.
Okay.
Yeah.
All right. There's a question someone was asking, how does, I think we touched on that in our first session on some medicine. Some people are on some kind of medication, for instance, HIV patients.
Yes.
How does that, how is the link? How does it affect the liver? Does it predispose the liver to infections?
Yeah, the HIV medicine, some of them are toxic to the liver. Not even HIV medicines only. There are other medication for other illnesses that damage the liver. So they don't predispose to infections. Liver disease itself, in advanced stages, may predispose someone to infections in itself. So if there's liver damage caused by HIV medication, what can be done is switching. Yeah, because there are a number of options. So we just switch to another class. Also, we tend to avoid drugs that interact with each other. If you take 2 drugs or 3 of them that are metabolized by the same enzyme in the liver, and you take them at the same time, the enzyme is going to be overwhelmed and the drug is going to accumulate. So we tend to avoid drugs that interact in that manner.
Okay.
Yeah.
Thank you, Dr. Weti. Now, time is against us, but briefly tell us what are some of the challenges in managing other health conditions, especially in people with the liver cirrhosis?
Yeah, one, someone has kidney injury or kidney disease, heart disease, and someone has a convulsive disorder and has liver cirrhosis. First of all, liver cirrhosis in advanced stages, when someone has what we call hepatic encephalopathy, convulsions are likely to be more. So you keep taking anticonvulsants, which are also metabolized by the liver, which is dysfunctional. So it becomes very difficult to treat. Number 2, the heart disease and liver injury. Heart disease can worsen liver disease. Liver disease can worsen heart disease. Yeah, so there's a challenge. And then you take medicine. Those medicine for managing heart conditions are metabolized by the liver, which is not functioning nicely. And then we have kidney injury. Now, liver disease causes kidney, some retention of waste products or protein digestion, which are excreted in the kidney. So you becomes also a vicious cycle. Those are some of the things that are difficult to handle. And then the last one is medicine. Medicine that are taken for other health conditions other than convulsion, heart disease or kidney, that are also manufactured in the liver. So you take them, it accumulates in blood and can be toxic also. Yeah.
Thank you very much, Dr. Witi, for that information, important information. Now, as we wrap up or end the discussion, what would you like to tell our viewer in as far as liver cirrhosis is concerned? Please tie that with, I can see you wearing a t-shirt, the Matter Heart Run. And I know it's an iconic program. Most of us have heard about it or have even participated actively in it. Please, your parting shot.
Yeah, so touching on liver cirrhosis, the last things I would like to put across, we understand the commonest cause of liver cirrhosis in our setting is alcohol. So we need to limit that. And once liver disease has been diagnosed, it's best to avoid alcohol. There are a number of patients that we have seen that they have liver cirrhosis. You treat them, they recover. They go home, take more alcohol, then come back worse. So cooperation in that regard is key to safeguard health. Touching on Matahatran is a program that aims to help children with congenital heart disease, especially with heart disease, which with the emphasis on rheumatic heart disease, but all of them with congenital heart disease that are also helped. These are diseases that of the heart that the children are born with. And there are those that they acquire. One of the acquired is rheumatic heart disease. So the program helps to address those issues through surgical intervention as well as medical intervention. So we usually go to the counties, we screen, and we select some of the children that fit for that can actually benefit from this program. So next week on Monday we are starting, because we halted it a bit because of COVID-19 the last 2 years. So it's resuming on Monday, and then the official launch will be held in April on the 6th at KICC. So we ask for your support in that regard.
All right.
Thank you. Yes.
Thank you very much for creating time for this discussion and for the important information you've shared with our viewer. We appreciate that, and we hope they got the information and they're going to turn up in large numbers for the event. Thank you very much, dear viewer. And at this point, we'd like to close the discussion. We believe you've gleaned what you need to know about liver cirrhosis. In case you have more questions, the reason you can call the number on the advert that's going to run immediately after this discussion, and you'll be guided and gain more information on what you really need. That's include medical appointment and consultation at Mater Misericordia Hospital. Allow me to extend my gratitudes to the team working behind the scenes as usual. Let me start with the Capuchin TV team. This program is coordinated by Father Vincent Shumila, and I would like to thank the team, the crew, starting with the camera persons, Venanju Nganga and Alan Andiva. On the visual mixing desk, we have Samuel Cherubora and Teresia Wanjiku. Thank you very much. Our sound operator has been Eric Otieno. And on the other chamber, that is a live transmission chamber, the person who ensures that you receive this or you're able to watch this on all our social media platforms, and of course the TV, has been Michael Kibandi. Thank you very much, the entire team, for your concerted efforts to make sure this goes on swiftly as planned. And I wouldn't like to close this without thanking the team from Mater Hospital, which is coordinated by Sister Benedict Mueni, and we have also Benjamin Mutiso, and with me here, who has been really giving you important information on this health condition, has been Dr. Owiti Calvins. Now it has been a great session, and I hope to see you next time. Remember, it is not just about avoiding a disease or an illness. Rather, it's more of a physical, mental, and social well-being. So in this Love Month, make sure you love yourself first before you extend it to somebody else. So stay in control of your physical, mental, and social well-being. My name is Asasha Elizabeth. See you next time. Have a great weekend.
Capuchin TV, your Catholic broadcasting ministry.
Welcome to Mata Misericordia Hospital, Buru Buru Clinic for holistic medical services.
This is Buru Buru Medical Center, which is part of Mata Hospital. And at Buru Buru, we essentially offer services offered in Mata Hospital.
We are located in the first floor failing building above Quick Mart. In Buru Buru, we have general consultation Monday to Friday. Saturday and Sunday they are still available. We still have specialists. On Tuesday and Thursday we have our gynecology clinics running from 8 a.m. to 2 p.m. We have a pediatrician clinic running on Wednesday at 8 a.m. to 2 p.m. We normally have a wellness, which we normally do from Monday to Sunday. Every day, feel welcome, you can come.
Experience the difference in our wide range of quality, responsive and compassionate healthcare services.
We have very highly skilled and qualified staff running the units. We offer services including doctor's consultation services, which is a general doctor in the outpatient unit. We also have laboratory services and pharmacy services. On particular days of the week, we have specialized clinics, which include the physician clinic, where we have our hypertension and diabetes patients followed up. And then we also have the obstetric gynecology clinic, which is run on Tuesdays and on Thursdays. We have the pediatric clinic, which is run on Wednesdays. And then we also have the ENT clinic, where we have the ENT doctor coming in, and that is run on Fridays in the morning. There is also a pediatric surgery clinic, which is also on Fridays.
Our child welfare, we normally do them on Wednesday, Friday, and Saturday from 8 a.m. to 2 p.m. We have our ENT clinic Friday, 8 a.m. to 10 a.m. We normally have nutrition services on Tuesday to Thursday, and we have extended our radiology services from Monday to Friday to Saturday nowadays. Initially we were running up to Friday, but currently going up to Saturday.
We deliver all our services with utmost diligence, integrity and equality.
We see everyone at the Buru Buru branch. We do not discriminate against anyone, either on race, on religious grounds, or disabled people. You are all welcome to receive services at our branch.
Be assured of privacy. We normally keep to our ethics. We are so compassionate to our clients. Integrity is all over. So when you come, we feel you, and that is why you can see nowadays we are running, like every Friday we are having a special clinic. Currently we are running the breast clinic. Next month we are coming up with clear colon screening. So don't forget we are Christ-centered. When you come, and we don't segregate because you are a Christian or a Muslim or Hindu. We treat every client as equal as any other.